Joining me now from San Francisco is Dr. Peter Chin Hong, Professor of Medicine and Infectious Disease Specialist at University of California, San Francisco. Peter, good to see you. It's certainly been a while. We were talking about COVID a few years ago. Now we've got this measles outbreak. How concerned should we be with these cases soaring?
We should be very concerned, Asieh, not only about the deaths or the hospitalizations, but the disruptions that it causes. Every time a kid is taken out of school, it takes up to 3 weeks to develop disease after being exposed. So that means parents, et cetera, have to lose work. You also have this concept of immune amnesia. Once you get measles, you kind of get wiped out for a little bit and more susceptible to other infections. And finally, I would say that measles is the canary in the coal mine. We focus on measles because it's so transmissible, but we're also talking about other things like whooping cough and mumps and German measles and things like that.
And if I could just focus on measles for a while, most kids, from my understanding, you tell me if I'm wrong, recover from measles if they get it, but infection can lead to very dangerous complications here.
Yes, 1 in 20 kids will be hospitalized. 1 in 20 can have pneumonia or brain swelling that can lead to blindness. But the long-term effects are also been very well documented. A long COVID version of measles called SSPE can happen 10 years after. So it's not a walk in the park, and it's something that we need to focus on because we don't have effective treatments. Prevention is really our best weapon.
As our reporter Jim Spellman mentioned in his piece, in 2000, measles had been declared eliminated here in the United States. So clearly, Peter, we had a lot of progress. I spoke to one physician earlier this week who was alarmed like you are, and he basically told me, we're going backwards. Do you agree with that assessment?
We're totally going backwards. Before, when I started medicine, we were learning measles to study for our board exams. But now we're reteaching it to physicians and clinicians at all levels, not only medical students, but also practicing clinicians and clinicians in the community as well. We all have to relearn all of these infections.
And of course, the best way parents can protect their children is through vaccinations. And yet we have so much misinformation, so much disinformation, Peter, and that, of course, is creating a big problem.
It is a big problem, and we have to look at windows of opportunities. For example, really working with pregnant people in the postpartum period when people are more receptive to listening to information that can protect their child. We have to really fund public health, like the report says, more efficiently so that we can do the right contact tracing. So a lot of things need to fall in place. We did it before. I think we can do it again.
And Robert F. Kennedy Jr., who's the highest health official in this country, has endorsed the measles vaccine, but his endorsement, if you will, has been rather tepid. He said, we've done a very, very good job at controlling it. He was responding to criticism from Democratic leaders who basically say we should be declaring a public health emergency, arguing additional federal resources are needed. Do you think at this point this should in fact be declared a public health emergency?
It should. Being a public health emergency doesn't mean we shut down and we close ourselves up. It means that we divert resources and all hands on deck to really nipping it in the bud, which we can. We are at the risk of losing our elimination status if we have sustained transmission for more than a year, which it looks like we're on track to doing. And, it will really be, going back in time and something that we can easily not have to do.
All right, Dr. Peter Chin Hong, as always, thank you very much.